In our last lecture of this week, I want to just go over a couple of healthcare terms that will be helpful for you as we move forward in the semester. So, the first term I want to talk about is universal healthcare. There's been a lot of conversation about this in our political discourse with ideas about Medicare for all. And I want to be clear that there are distinctions in this. Universal healthcare is the idea that everyone in society has access to affordable healthcare. Okay. Now, Medicare for all is a single payer answer. Single payer is one way to get to universal health care. It is certainly the least expensive way, but it isn't always the most efficient, and there are many ways to get there. Um, the UK and Canada do have single payer, but they also actually have private insurance on top of it. There are other models around the world. Germany has a combination of private insurance and public insurance. There are so many different models, and part of what's happened in our healthcare debate is that one way of getting to universal healthcare has become synonymous with universal healthcare. And we should be aware that we're having arguments about the process of how to get somewhere as opposed to the end result. And I'm not actually convinced personally that a single payer model is one that will work in the US just because of the sheer number of people who work in the health insurance industry and associated industries. If you were to get rid of private insurance, you would move so many people onto unemployment. And so if you are going to move to single payer, it really has to be a phased mode to get there because it just would be so disruptive to the economy to simply have it evaporate. So it's worth thinking about this. We have really good ideas of things that would work in theory that may not work as well in practice. And a lot of what I want you to be thinking about in this class is how we take really big, important ideas and values and translate them into policy. Ideas can fit on bumper stickers. Policy never can and never should. So we have to be willing to engage with the complexity of the systems in which we are working. And there are few things as complex as the American healthcare system. What are some other terms you should know? An HMO. This stands for Health Maintenance Organization. It is a type of insurance. And really, what distinguishes this from other types of insurance is that patients have a gatekeeper. They're usually their primary care physician or PCP, who's responsible for the overall care of members. If you want to go to a specialist, you need to get a referral from your PCP. Non-emergency hospital admissions also require specific pre-authorization by your primary care physician. Typically, services that are performed by people outside of the HMO are not covered unless it's an emergency situation, as defined by the HMO. But there are some real horror stories about this. People go even to a hospital that is in network, is part of the HMO, but the hospital has contracted out to an anesthesiologist who is not a member of that, and that's a separate bill that isn't paid for, and the patient ends up responsible for it. So we're seeing these crop up, and we're seeing legislative suggestions of how to fix that. Another term, a PPO, which is a preferred provider organization. And it's very similar to an HMO in terms of it being a group of medical providers and organizations with whom you have your insurance has a relationship. But the most obvious difference between an HMO and a PPO is that members aren't required to work through a primary care physician in order to get referrals. You're also not limited to PPO and physicians. You can go outside of network, but those costs are going to be higher. So in a PPO, you have out-of-pocket expenses, but most of them will cap those out-of-pocket expenses. And depending on the level of your coverage, you may have higher deductibles. Another type of insurance you can think about or term you should know about is ACO, which is an accountable care organization. And these are our new kind that are really being experimented with. And this is a group of healthcare providers, which include doctors, hospitals, other healthcare constituents. And they come together to coordinate high quality care. The goal is to provide this coordinated care to ensure that patients and populations, especially the chronically ill, get the right care at the right time and without harm. All of this while avoiding care that's been proven that really doesn't have any proven benefit or is unnecessary duplication of services. Providers who work under these plans focus on preventative health care because there's greater financial reward in this system for the prevention of illness than the treatment of those who are ill. These plans dissuade providers from the use of expensive, newly developed treatments that can be less effective or only have marginally higher success rates. And so this is a way of trying to control costs, but especially when we're thinking about the kind of care, we can see how this might be disadvantaged for certain communities. And we have to be aware of how bias might fit into that, actually, with all of these systems. Another term is an FSA. This is a flexible spending account. These are accounts that employees can contribute their pre-tax dollars to that can be used for medical expenses. So that could be for your deductibles. It could be for over-the-counter medications or copays on medications. Sometimes you can get other treatment like acupuncture, for instance, might come under this. And basically, you do this through your employer. You set aside a certain amount of money that's going to be used for that, and you can have access to that. It's pre-tax dollars, so essentially you're getting more bang for your buck. You can do about, I believe it's $2,600 for each individual, and for a couple, it's $5,200 that you can put aside for this, a maximum of that. The catch is that it doesn't roll over year to year, so that if you put that money aside, but you didn't use it, then you lose it. So, you got to say, hey, let's go on a spending spree. Let's go get some dental work or something to make sure we use all that money. The last term is an HSA, which is a health savings account. This is similar to an FSA in that you can put in pre-tax dollars for approved medical expenses. But this money is, while it rolls over from year to year, it's only available to people with high deductible plans. So individuals can deposit up to $6,500 a year, and families $13,100. The idea here is to encourage people to save for future health problems, and that it would make them more thoughtful consumers. There is no evidence that this works, especially when you consider that that $13,100 really isn't going to go very far if you find yourself in need of emergency care. All right. Thanks for bearing with me with all of these lectures for this week. And I'm looking forward to our class to talk about these terms in greater detail.